This is Tom Bernanke, and there's one magical food right now that's getting all the hype about cleaning up arterial sclerosis, blood clots, cleaning out calcium from the arteries. Is this possible, or is this snake oil salesman? We're going into the research, and if you should eat this one magical food, we're starting now. So this is crazy. I'm seeing a lot of other people posting about this magical food, and it's getting millions of views. But that food contains both vitamin K2 and something called nattokinase. Its popularity is blowing up during the 2020 lockdowns because it functions as a natural blood thinner. Whereas vitamin K2 is very effective and very proven at directing calcium out of the arteries and into bone to limit osteoporosis and get people healthier. Arteriosclerosis, peripheral arterial disease, coronary heart disease, this is one of the big killers. So one of the top 4 things to essentially take us out.
A blood clot is different than arterial plaque. You can see a blood clot is a clumping of the vessels, whereas calcification and arterial plaque develop inside the walls and it makes the walls thicken. This is cholesterol, this is fat from inflammation. And what happens is it takes up more and more of the artery center. This is different than calcification. This is more of a fat buildup.
Our diabetes rates are going up.
On the other hand, with diabetes, which is significantly rising around the world, I see more calcified vessels as well as the arterial plaque. This is called Monkenberg sclerosis in the foot. I see this quite a bit on my diabetic foot x-rays. The beauty is this superfood combines 2 methods, so it hits both the blood clot and it hits the calcium. It can help with all of these if it works as good as people say it works.
By the way, I just realized, you know what's number 1 for men under 35, even men under 55? It's suicide now. Suicide, depression, mental health problems are going up through the roof. With all the advances we know and how much happier society should be, it is insane that that is the number 1 killer in men under 55. Does this one magical food have Alzheimer's, peripheral arterial disease, arteriosclerosis applications? Let's take a peek. Number 1, nattokinase. This is available now as a supplement, and spoiler alert, we're going to be talking about a fermented Japanese soybean dish that's available for a low cost. But I do go over my top 15 foods list on vitamins. Nattokinase is a natural enzyme that's a fibrinolytic. That means it helps dissolve blood clots and it helps improve blood circulation. It works by breaking down the blood clots, specifically fibrin. That's a protein that's involved in clot formation. This can reduce the risk of thrombosis or a blood clot in the leg. It can also help with blood pressure. So some studies suggest it can help lower blood pressure, but it does have side effects and interactions that can interact with blood thinners. So if you're on a blood thinner already, like warfarin or Xarelto, it can increase your risk of bleeding, so be very careful. This one magical food also contains vitamin K2. I love vitamin K2. This is something me and my family take every single day. You want to get about 90 to 180 micrograms every single day. There's a couple variations of it, MK4 and MK7. This magical food contains 1100 micrograms per 100 grams. That's a ton. So I actually have a top 15 vitamin K2 foods list. So you don't need to supplement this stuff. If you're eating it from the diet, you can get vitamin K2, but this food is the clear number 1 winner by far. It's a Japanese fermented dish that's produced by gut bacteria. Vitamin K2 plays a crucial role in bone health and cardiovascular health. I like to think about it like this. Vitamin D takes calcium from your gut and puts it into your blood vessels, and it raises it in your blood, whereas vitamin K2 helps take it out of your blood vessels and gets it into the right place, which is the bone. If you don't have adequate vitamin K2, which, spoiler alert, a lot of people, over 50%, are deficient according to some organizations.
The World Health Organization, FAO, say that people probably only get 5 to 25% of their daily recommended value of vitamin K2. There's two types, MK4 and MK7. MK7 lasts a lot longer, and it's found in fermented foods, natto, soy, sauerkraut, cheese. It is also made by GI tract fermentation.
Our nutrition is decreasing as we're eating more pastries, more grains, more baked goods. We're eating less meats, less green vegetables.
Get the obesity rates around the world. It's not just North America and the United States, which is a myth. Europe's actually a little bit higher. South America's getting up there. The world overall, Asia, Oceania, and even Africa is getting up there. So everyone is getting more and more obese. So look at these statistics. Since just 2000, it's gone up from 30% to 42.4%. And even the severe obesity rate has doubled. So it's going up. And what about COVID? When COVID started, the rates shot up even more rapidly. So this problem is already horrible and it's only getting worse. People are getting higher rates of diabetes. Everything I'm going to talk about here is more relevant than ever. To me, these rates are crazy. Pakistan, Egypt, Qatar, Malaysia, Saudi Arabia, the Middle East, Mexico, extremely high diabetes rate. The US is actually number 55 in terms of population. Right around there is China. And believe it or not, China actually has the most overall diabetics in the world now. And after COVID, the pre-diabetes rate is rising. So China and India make up the vast majority of diabetics worldwide, and it's increasing rapidly. Diabetics are much more likely to have arterial plaque and calcified arteries. This is called Mönchengladbach sclerosis. I see this a lot in my diabetic patients. When I took a foot x-ray, the vessel is just really calcified.
Then the risk is that that calcium can get into the arteries. Now, I've seen this firsthand. When I was a resident at the hospital, I worked with a cardiothoracic surgeon. He had me hold a blood vessel, and when I went to go squeeze it to put pressure on it, I could feel how crunchy and inflexible it was. So I work with a lot of foot arteries, so I see it, but one of these major vessels coming out of the heart, that's crazy to me. Vitamin K2 activates matrix GLA protein, which inhibits arterial calcification and may reduce the risk of coronary heart disease.
Vitamin K2, especially MK7, does a few things. It essentially causes gamma carboxylation of glutamic acid residues. And what that does is it activates matrix GLA protein and osteocalcin. These are important in taking calcium and putting it into bone. So essentially, when you're getting proper vitamin K2, your teeth will be stronger, your bones will be stronger. All these things will do a little bit better. You'll have less osteoporosis. At the very least, it reverses the benefits of a deficiency. So that's what the studies show.
I go over that specifically in my new studies on vitamin K2, but there's a lot of promising research. Same with dental health, same with bone health. But it does have interactions and side effects. It's generally considered very safe, but it can interfere with anticoagulants, specifically warfarin, Xarelto. So while it is safe for most people, if you are severely at risk, check with your doctor or whoever's prescribing you your blood thinner just to make sure they don't both accumulate to a massive level. What's the difference between nattokinase and vitamin K2? They both can help with arteries. The nattokinase breaks down blood clots, whereas the vitamin K2 takes that calcium and puts it into the bone, make sure it doesn't build up in the arteries. They both can help in that regard. That's why you have all these sensational videos. Nattokinase is primarily used for breaking up that clot. The studies, I go over whether it's worth taking or not as a supplement. Right now, I think the studies need a little bit more.
Another huge unique point of natto is the fact that it has nattokinase. This is a natural thrombolytic agent. That means it's a natural agent that dissolves blood clots. There's a lot of questions. Does it actually pass through our stomachs without being digested? Is it useful? Well, guess what? Every single manufacturer has jumped on it. It's popular. There's over 20,000 searches per month in America looking this supplement up. It is so popular. I did a whole video on it looking at the pros, the cons. Does it do anything? How much is a natto? Is it worth taking if you're worried about blood clots? I go over that video below. But natto, crazy. It's such a unique food, has high K2, which cleans out the calcium, and has something called nattokinase, which breaks up blood clots. We are in luck. They did a double randomized control, placebo-controlled clinical trial on nattokinase. That means they broke up a group of 113 people. Half, or 55, took nattokinase, and 58 got fake nattokinase that didn't really do anything. And at the end of a 120-day interval, so 4 months, there was no real difference. So for whatever reason, in the real world, they did not observe significant differences taking nattokinase supplements. If you eat natto and you have vascular disease, tell me if it made a difference in the real world. These studies are all such small numbers. I feel like in this YouTube video alone, we can get more scientific evidence and more feedback than some of these studies have been able to. It's actually very interesting to learn what people's experiences are on a large scale. So let me know down below. It should be fun.
Whereas vitamin K2, that's something that I take every day. I think it's very well proven. I think a lot of prominent cardiologists now strongly recommend it for their patients.
Calcification of arteries is a very big problem these days. It is one of the major causes of arterial stiffening. Take a look at this CT angiogram. This is someone with calcified, and that means bone in your arteries. It stiffens them so they're not flexible. It decreases the blood flow. You get cold toes or blood flow. As a foot and ankle specialist, I check the posterior tibial artery pulse, the anterior tibial artery pulse. This sets a good guideline. If those feel great, then you don't have to do much more. And the way you feel it is bounding pulses up and down. And we also check the capillary refill time. That means when you squeeze the toe, does it refill instantly? If it doesn't, if it's more than 3 seconds, we can use a computer to perform a test. We could perform what's called an ankle brachial index. So that's basically comparing your arms to your feet. Are there potential blockages somewhere? And if there are blockages, so for example, if one ankle is much worse flow than the other or compared to your arms, then we might want to do more testing. You can check the toes and then you can order imaging. You can get what's called a CT angiogram. But what I do is I work with a vascular surgery team. So I work with great vascular surgeons. Essentially right away, they can do a test which is an angiogram, or they can release dye. They can essentially check if anything's narrowed or blocked, and then you can correct it. So this is one of the images where you could see, is there cholesterol built up? Is there a plaque? Is there calcification? But one of the things that can really help with this is vitamin K2. You want to get that calcium into your bone. So studies show vitamin K2 is very beneficial with patients with aortic valve calcification, and a couple other studies too, combined with vitamin D. Now, it won't reverse your arteriosclerosis and make you like a baby again, but it can prevent it from getting worse. And especially the earlier you start, the more benefit it can have.
The reality is this food is called natto. It is a Japanese dish that's fermented by bacteria. I looked up the grocery stores around me, like $10, $15, you can buy a decent chunk of natto. It's pretty readily available. There are some complaints that it's slimy, it doesn't taste good, people don't like the texture. I know if you eat too much, it gets too much fiber, it could give you like diarrhea almost. But nattokinase, this is the only food that nattokinase is found in. There are supplements of nattokinase, but this is the only food.
There is another very popular option that's a supplement now called serrapeptase. Do I think the studies are quite there yet? Not quite, but I go over it in a video. Another great option as a blood thinner is turmeric. That is very proven.
Human studies tend to use around 500 to 5,000 fibrinolysis units daily. It's hard to say how much is present in your natto because the fermentation process can be up or down, but you don't want to go crazy. You don't want to eat more than like 15 grams of natto daily over more than a 2-week period. So you want to eat a decent amount as a side dish, but you don't want to do it every day. You're going to get diarrhea and it could potentially thin your blood too much. That could be a real risk. The specific amount does depend on the specific strain of the bacteria that's doing the fermenting, but there's no specific measurement. I read so many articles, nobody's really come into a consensus, but the bottom line is it can help degrade fibrin, it can help with blood clots. Now the real question is too, is it digested in our stomach or does it actually get into the blood system? Does it have to be injected? That's a whole new story.
Sometimes people take supplements that are huge molecules. how the heck do these get absorbed? Well, the answer is large molecules don't. They have to get broken down into their elements or smaller amino acids and get transported through the membrane. So a study just took a look at this like a month or two ago. So I'm actually very impressed how recently this came out. If nattokinase is actually transported into the body, because I always thought, hey, if you eat this large enzyme, is it just digested and broken down and becomes useless and cannibalized for its amino acids? But apparently this nattokinase does bind to some receptors, and what happens is a liposome forms, and it's like a carrier molecule through the cell membrane, and it does actually get into the blood vessels to an extent. It's not a lot of it, probably a smaller percentage of it. So we have to see just how effective it is. The beauty is we do know that if nattokinase makes it into the blood vessel, that it does get in there and it can break up that clot. It is an anticoagulant, so it is very effective.
But natto, on the other hand, does have vitamin K2. Some studies do show that 1100 micrograms per 100 gram unit, even though micrograms are small, that's about 10 times your daily dose. So you definitely don't want to be eating your 100 gram units.
If you eat natto, I would love a comment down below. Tell me if you feel it's working. Have you had any lab studies done? I'm very interested to see how this stuff works in the real world because the studies aren't very reliable. But the beauty of natto is it's the only one with nattokinase. It's made by the fermentation, but a lot of other foods have different types of vitamin K2, which is also beneficial. You have cheeses, you have goose liver. I can't pronounce some of them, but chicken liver, Gouda cheese, eggs are a really easy one to get some vitamin K2. Pepperoni, salami, cheeses, chicken wings. Now, my carnivore friends will love this because the beauty is, especially with butter, some of these foods get a really bad rap for heart health, but a lot of new studies now, because of things like vitamin K2, are showing that potentially things like butter may not be as bad as we thought. They might actually offer some benefits. Now, something to think about. In Hong Kong, they have the highest rates of meat eating, and they have the longest lifespan at over 85 years old. Whereas in India, they eat the least amount of meat and hence least amount of K2, and they have the most heart attacks compared to some of the larger countries. MK4 is a quicker one, but it might have better absorption. MK7 lasts longer, but is more for bone health. Now, the big myth was freezing versus cooking. That seems to have been debunked. If you can't get it through food, the supplements are actually very beneficial. I've looked at all the studies. Most of them range between 90 to 180 micrograms. Some go up to 360 micrograms. There's not really a lot of negatives about overdosing to a reasonable extent. In fact, some people actually take larger amounts in the studies, but I do want to caution you, there are side effects. If you are on blood thinners, you want to check with your doctor. Now, these are my more unhealthy patients with heart issues, with blood flow issues, but unfortunately, that's who this is targeted for. So the medical disclaimer is always double check. Even though this is a natural compound, you can still overdo it on natural compounds. But the bottom line is this is something that was much more present in our diets, but is now much less present in our diets. The results are more and more documented. Tell me what you think.
Tell me if you eat natto. Tell me if it's benefiting you. Tell me if you're noticing any blood thinning risks. Right now, the research is probably too new, especially on nattokinase, but for vitamin K2, it's very well proven. So if you see these videos about the one magic food that reduces your arteriosclerosis and calcium, they're talking about natto. But you know what? A lot of the research is very valid.
I think a case could be made that turmeric is actually the #1 anticoagulant food over nattokinase, as curcumin, the active ingredient in turmeric, is extremely well studied and does have a lot of benefits like breaking up blood clots, blood thinning, and its anti-inflammatory functions.
If you have a concern about a blood clot, or if you have arteriosclerosis, check out my guides on those things. I give you my practical and good home remedies and treatments and what to do if you have certain signs or symptoms below.